Hi everyone, I'm Sarah Michi. I am the Holzer Family Pharmacy resident in Gallipolis, Ohio, and today I'm going to review vaccines with you. So through this lecture, you should be able to describe the types of immunity, classify vaccinations as either live or inactivated and apply to a patient case, describe proper storage techniques and administration of vaccinations, identify adverse reactions, and contraindications and precautions of vaccinations, as well as determine the appropriate vaccines to recommend for a patient based upon their age and risk of disease. So there are two types of immunity, active and passive. Active is when it's produced by your own immune system. So these you require either to have had the active disease or to receive a vaccination against it, and they involve this type of immunity involves memory B cells. Passive immunity is produced by an animal or human and transferred to another. So this has a rapid onset and a brief duration for it. An example would be from mother to baby. There are two types of live and inactivated vaccines, and I would make sure that I know solidly the types live vaccines. That way you can determine whether the vaccine is live or inactivated, and any information that needs to go along with that. I learned the live one just because it's a lot shorter of a list in my opinion. So shorter the information and still get the same amount, go for it. So your live ones are the herpes, influenza, measles, mumps, rotavirus, rubella, typhoid, varicella, smallpox, and yellow fever. Vaccination schedules. These should be at least 4 weeks between doses for most vaccines. It's never necessary to restart a vaccine series except in the case of oral typhoid vaccine. You can give inactivated and live vaccines at the same time. However, if two live vaccines are not given on the same day, you must wait at least 4 weeks before giving them. The exception is for oral live vaccines, and those can be given simultaneously or at any interval with other live vaccines. Adverse reactions, I would know whether or not a reaction is a local or a systemic or a potential for an allergic reaction. And for these, your local reactions are your pain, swelling, or redness, things that you kind of think about when you get a vaccine. These usually occur within minutes to hours of an injection, and they're usually mild and self-limiting. Systemic reactions, however, are similar to a mild case of the disease, and they're more common after live vaccines. Allergic reactions are rare but can be life-threatening, so I would know what signs to look for. So problems breathing are your usual big key for that one. Syncope is becoming more common, and it's important to observe a patient for at least 15 minutes after the vaccination. Any adverse events should be reported within 30 days to the CDC. Contraindications for vaccines, these do kind of vary by the vaccine itself, but the live have more contraindications than the inactivated. So pregnancy, immunosuppression, and active untreated TB are contraindications for them, as well as for any type of vaccine, and anaphylactic reaction to a previous dose or to any of the components is a reason to not give it to a patient. Precautions are usually if the patient is currently ill or has recently received blood products or live vaccines, and I would know which vaccines are contraindicated in certain populations. For vaccine management, just try to ensure that as soon as it arrives at your site that you put it either in the fridge or the freezer, depending on what the manufacturer recommendations are. You should monitor temperatures daily in the fridge and record in the log. Make sure you do not store the vaccines in the door. They should be stored in the middle of the refrigerator to get adequate cooling for them. And as well, just typical inventory management, you want to make sure you're keeping a log and rotating stock and checking expiration dates. So as we go through the next several slides here, there are some charts for each of the vaccines that are available. I'm not going to read through them. They're more for study purposes for you all for when you're studying for the boards. So the first one we're going to talk about today is the pneumococcal, and I should mention that there are new CDC recommendations that came out this past fall, and I would know these new recommendations as your test will reflect these new changes. So the 23 and the 13 are the ones that are now indicated for patients who are 65 and older. as well as those with certain chronic disease states such as diabetes and heart failure patients, as well as smokers. So here are the new recommendations for them. Basically, if the patient hasn't had a pneumococcal vaccine before, they're going to get the Prevnar 13, wait 6 to 12 weeks, and then they're going to get the Pneumovax 23. And there's variations depending upon how old the patient is and whether or not they've had previous vaccination against the pneumococcals. Influenza, for these I would make sure I know the differences between the terms of antigenic drift and antigenic shift. Antigenic drift is a frequent minor changes in the antigenic structure of the virus, and these can be reach the level of epidemic, but not typically each year. This is why we have to have yearly adjustments in the annual flu vaccine formula. Antigenic shift is when there are major changes in one or both of the major antigens in influenza A, and this results in major pandemics. So influenza A, or influenza in general, you're probably familiar with. It's usually person-to-person droplet contamination or by contact, and this is an abrupt onset with fever, sore throat, non-productive cough, typically peaks between December and March. The formula for the 2014-2015 year happened to have the same strains as the 2013-2014 year. There is actually available a quadrivalent this year, which has 2 A and 2 B strains in it, whereas the trivalent just has 2 A's and 1 B in it. And you can see those listed here. I would become familiar with the abbreviations for these types of vaccines for them. So there's the inactivated flu vaccine, the live attenuated flu vaccine, the recombinant one, and the cell cultured one. So the recommendations for the 2014-2015 year, the live quadrivalent is preferred in healthy children, ages 2 to 8 years old, and this is the Flu Mist, the nasal spray. If it's not immediately available, you can use the inactivated vaccine in these patients. The patients who are at highest risk are listed here. There's several of them. So these are your chronic pulmonary patients, cardiovascular, women who may be pregnant or will become pregnant during the influenza season, patients who are morbidly obese. These sort of patients are at higher risk for them, and we should encourage them to receive a flu vaccine each year. As well as us healthcare professionals, we do need a flu vaccine every year. Here's a chart just comparing the differences between them. I would be familiar that you do have to revaccinate yearly, and then the typical adverse reactions that you can see with these vaccines. This is the live attenuated influenza intranasal spray. This way you're going to see a little bit different adverse reactions for it, so I would be familiar with those. And as well, I forgot to mention that with the inactivated one, if it is a child's first time getting this vaccine, they'll have to have it repeated in 1 month later, as long as they're under the age of 8. If they're over 8, we're just going to give them the one vaccine like everybody else. So with the intranasal, they also do have to have that redosing after it's their first time receiving it. There are newer influenza vaccines for patients with egg allergies. The Flublok does not have any egg albumin or protein in it. These can be given to patients with severe egg allergies. The trivalent cell culture-based inactivated influenza vaccine has some, but it's less than than the other influenza vaccines available for it. So this one can be given to patients with a mild egg allergy. Tetanus, this is an endotoxin produced by Clostridium tetani, classically characterized as lockjaw, involving face muscles and neck, and spasms can last 3 to 4 weeks, but a complete recovery can be expected within months for these ones. Pertussis, aka whooping cough, is caused by Bordetella pertussis, transmitted by human to human, and is highly contagious. For this one, you've got that characteristic whooping cough with it, hence the name for this one. And Tetanus and pertussis are available with diphtheria in a vaccine for this, either as a DTaP or a Tdap. And for these ones, I would be familiar with the 4 different abbreviations for these and which ones certain patients can get. So for pregnant women, you're going to want to give them a Tdap, and this would be during their 3rd trimester, 27 to 36 weeks for each pregnancy. This one passes the whooping cough protection onto the baby until they're old enough to get their own DTaP for this one. So I would just make sure that you're familiar with which ones are for pediatrics and which ones are for adolescent and adults. And this is just comparing the different types of brand names that are available for them. Some of them are a little bit more common to hear as like Adacel or Boostrix instead of the Tdap for them. But I would know also that encephalopathy occurring within 7 days of the previous vaccine is a contraindication for these vaccines. Hepatitis B is one of the most common infections worldwide. It's typically characterized by weakness and anorexia, jaundice. The malaise and weakness can last for weeks, 2 months after the other symptoms have resolved for this one. It is transmitted human to human by exposure to body fluids. So perinatal transmission and STIs are commonly seen with this one. For this one, for hepatitis, I would know that even though there is a serologic testing that is available, it may not be accurate 2 years after the vaccination, even though immunity continues for this, and you should not give booster shots no matter, depending on what level that vaccine, the serologic testing says, especially if that testing is done at more than 2 years after the vaccinations. Haemophilus influenza type B, or Hib. This is a gram-negative coccal bacillus. For it, it's primarily children that are affected. It peaks 6 to 7 months and rarely attacks after the age of 5. So for this one, this is one of the ones that you get at 2 months, 4 months, and 6 months old. For this one is the typical time that we're going to vaccinate these patients. And it's not indicated for patients who are greater than 59 months unless they're asplenic, immunodeficient, or on immunosuppressive therapy. It is available in a combination with hepatitis B or DTaP, depending on which combination brand you're looking at. Hepatitis A is the most common hepatitis infection in the U.S. It's typically characterized by malaise and weakness, anorexia, jaundice. Exposure to this is typically human to human by oral fecal route. Exposure to unimmunized patients, so this would be that they would need to get IgIM plus the vaccine series, unless they are healthy 1 to 49-year-olds, in which case they would only get the vaccine series. I would know what to do if a patient is exposed to hepatitis A and they have not been immunized. So here are the Twinrix and the Haverix. They're the vaccines for hepatitis A. I'd be familiar with their indications as well as just their typical adverse local reactions for this one. Meningococcal disease caused by Neisseria meningitis typically is the leading cause of meningitis in the U.S. Higher incidence in college freshmen, and there are different serotypes for this, and I would know that neither of the vaccines cover against serotype B. And here are one of the vaccines for it. There's another one on the next page. I would definitely know indications for getting this vaccine. So the military personnel, college freshmen, asplenia, lab workers, and those traveling to the meningitis belt, also known as the sub-Sahara Africa, definitely need to have this vaccine. And again, this is the other vaccine that's available for meningococcal disease. Polio. Polio is a virus that enters the mouth and replicates in the GI tract. And it is typically asymptomatic, but you can still transmit the disease. And treatment is supportive care. Person to person by oral fecal route is the common transmission for this one. There used to be an oral polio vaccine, OPV, but it was discontinued in the U.S. due to the elimination of wild-type polio disease, as well as one of the adverse events that it caused was not great. So it was pulled off our market. Measles, mumps, and rubella are characterized either by rashes or lymphadenopathy, and these ones are not as common anymore due to our vaccine. And this is a live attenuated vaccine, so therefore it's going to be contraindicated in pregnancy for it. You're going to see, for systemic reactions, mimic the mild cases of the disease for it. Varicella is caused by herpes zoster, a viral infection. Primary disease for it is chickenpox, and this is a rash that appears from macula to papule to vesicle before it crests over. Later on in life, it can reoccur as a herpes zoster, which is shingles, and this is typically related to immunosuppression and age. Herpes zoster can be transmitted by direct contact with non-immune people, and so therefore you want to use caution on contact with a patient that has shingles. So the varicella or chickenpox vaccine is alive and attenuated, so similar to what we've had before, mimicking mild case of the disease if they have a reaction to it, and should not be given to patients who are pregnant or are following pregnancy 4 weeks after. Shingles, as the Zostavax, is also live and attenuated. It's 14 times the dose of the varicella dose. Should not be given to patients who are immunosuppression, either due to disease or medication. This vaccine is kept frozen until you are going to mix it for the patient. So that would be one that I would know of how you definitely store this one. Adverse reactions have been similar to the other vaccines we've talked about already. Rotavirus is the most common severe gastroenteritis in infants and small children, typically mild watery diarrhea, limited duration for it, and transmitted by oral fecal route by close persons and through formites such as toys. There are 2 vaccines that are available for this, RotaTeq and Rotarix. Both of these are live and oral medications. Adverse events or adverse reactions for these are diarrhea and vomiting. And it's typically it can be given with other pediatric vaccines that are indicated at the same age of this one. HPV or human papillomavirus, most common STI in the U.S. And there are most common causes of cervical cancer by type 16 and 18, and genital warts most commonly caused by type 6 and 11. So those are the ones that we have vaccines for. There's a quadrivalent of Gardasil, and that covers for all 4 of the types that I just mentioned. And then there's Cervarix, which only covers for 16 and 18, those ones for cervical cancer. Combination vaccines, I would just be familiar that there are combination vaccines available, kind of know which vaccines are available in a combination for them, and what would be some contraindications or indications to use for these vaccines versus the single vaccines for them. Rabies, this was actually a very popular question on this past year's NAPLEX for it, so I would know what happens if a patient is exposed to rabies, so that post-exposure prophylaxis for them. I would know whether or not the patient needs to receive human rabies immunoglobulin, HRIG, and whether or not they need a rabies vaccine for them. Also, just know that casual contact for touching a person with rabies or contact with non-infectious fluid or tissue does not constitute an exposure for this one. I know that you also need to immediately wash the wounds with soap and water for it, and just your typical adverse reactions for it are similar to other vaccines that we've been talking about. Here are links to the schedule of immunizations. They're all available on the CDC website. They've got some good ways to help, nice colored charts that'll help you studying purposes of to which ones should a kid get versus which ones you need to get as an adult. And with that, there are my references. And if you have any questions, feel free to email me. Good luck on your exam.